Have you ever wondered what tumor markers are and how they are used in cancer diagnosis and treatment? Well, let's dive right in. Tumor markers are substances, often proteins, produced by the body in response to cancer growth. They can be found in blood, urine, or tissue, and their presence or levels can provide vital clues about the presence, type, and stage of cancer. Tumor markers are like breadcrumbs in a dense forest, leading oncologists on the path to understanding what's happening inside the body at a molecular level. They are not only involved in diagnosing cancer but also play a significant role in monitoring the progress of the disease and the effectiveness of treatment. Now you might be wondering, is there a perfect tumor marker that can tell us everything we need to know about a cancer? The answer, unfortunately, is no. The concept of an ideal tumor marker is a bit like the pursuit of a mirage. In theory, an ideal marker would be one that is produced exclusively by a cancer cell and not by normal cells, is easy to measure, is proportionate to tumor burden, and could indicate both the presence and the type of cancer. In reality, however, such a marker does not exist. Each tumor marker has its own strengths and weaknesses. Some may be produced by several types of cancers, making it difficult to pinpoint the exact cancer type. Others may also be produced by normal cells, which can lead to false positives. But despite these limitations, tumor markers are invaluable tools in oncology. They are pieces of a larger puzzle, providing critical information that, when combined with other diagnostic methods, can help create a clearer picture of the cancer landscape within a patient's body. So, while we continue to search for that elusive ideal tumor marker, we must also appreciate and utilize the markers we currently have at our disposal. As we can see, tumor markers are a crucial part of understanding and diagnosing cancer, even though an ideal marker is yet to be found. So, how do we detect these tumor markers and what types are there? The detection of tumor markers is a complex process involving a variety of techniques, each playing a critical role in unmasking the silent signs of cancer. Let's start with immunohistochemistry, a method that allows us to visualize these markers by using antibodies that bind to them. This method is particularly useful as it can provide information about the location of the tumor marker within a cell or tissue. Next in line is ELISA, or enzyme-linked immunosorbent assay, a test that uses enzymes and color changes to identify tumor markers. This method is known for its sensitivity and specificity, making it a popular choice for the detection of these markers. Another powerful tool in our arsenal is flow cytometry. By utilizing lasers and detectors, this technique can measure physical and chemical characteristics of cells, including the presence of tumor markers. Lastly, we have genetic analysis techniques. These methods, which include DNA sequencing and gene expression profiling, can detect genetic alterations and help identify tumor markers at the genetic level. Moving on, let's discuss the classification of tumor markers. They can be classified based on their molecular nature. For instance, oncofetal antigens, hormones, glycoproteins, and enzymes. Oncofetal antigens are proteins that are typically observed during fetal development but can reappear in cancer. An example of this is alpha-fetoprotein, a marker for liver cancer. Hormones can also act as tumor markers. The prostate-specific antigen, or PSA, is a hormone that can indicate the presence of prostate cancer. Glycoproteins, another type of tumor marker, include CA-125, which is associated with ovarian cancer. Lastly, we have enzymes. An example of this is the enzyme lactate dehydrogenase, which can be elevated in several types of cancer. The diverse nature of tumor markers and the range of detection methods highlight the complexity of cancer diagnosis. But with these tools at our disposal, we can continue to improve our understanding of cancer and strive towards more accurate and early detection. Knowing what tumor markers are and how to detect them is only half the battle. How are they used in a clinical setting? Tumor markers are like the clues in a detective novel, providing vital information about the presence and progression of cancer in the body. They find their application in various areas in the clinical realm. For instance, screening. Tumor markers can help identify the presence of cancer even before any symptoms appear. They act as an early warning system, particularly useful in cancers that are difficult to detect in their initial stages. Next up is diagnosis. Here, tumor markers aid in determining the type and location of cancer. They can help distinguish between different types of tumors, adding another layer to the diagnostic process. Then comes prognosis. Tumor markers can provide insights into how aggressive a cancer might be and how it might respond to treatment. This information can be critical in shaping a patient's treatment plan. Tumor markers also play a role in predicting therapeutic response. They can help oncologists determine whether a particular treatment is effective or if it should be altered. This is especially crucial in personalized medicine, where treatments are tailored to the individual. Monitoring disease or recurrence is another area where tumor markers shine. Regular monitoring of these markers can signal if the cancer is progressing, remaining stable, or if it has returned after a period of remission. However, it's not just about knowing when to use tumor markers. It's equally important to understand how to interpret the results. Factors like the testing methods used, the half-lives of the markers, patient characteristics, and potential interfering factors should all be considered. And here's an essential takeaway. While tumor markers are incredibly useful tools, they should never be used in isolation. They are part of a larger diagnostic toolset and should be used judiciously, supplementing other diagnostic modalities. While tumor markers provide valuable insights, they should not be the sole basis for diagnosis or treatment decisions. As we wrap up, let's revisit the key points about tumor markers. These biomarkers, though not the elusive ideal we might hope for, play an essential role in the world of oncology. From oncofetal antigens to enzymes, their molecular nature is as diverse as the cancers they help to identify. The methods we use to detect these markers are equally varied, incorporating techniques like immunohistochemistry, ELISA, flow cytometry, and genetic analysis. Each method offers its own unique insights, contributing to a more comprehensive understanding of a patient's condition. But the real power of tumor markers lies in their clinical applications. They aid in screening for cancer, diagnosing it, predicting therapeutic responses, and monitoring disease progression or recurrence. They're not just indicators of disease, they're guides, helping us navigate the complex landscape of cancer care. However, it's crucial to remember their place within the broader context. Tumor markers are invaluable, yes, but they are not the sole determining factor in diagnosis or treatment decisions. Remember, while tumor markers are an invaluable tool in cancer diagnosis and treatment, they are just one piece of a much larger puzzle in the fight against cancer.